We had the experience when our son was 9 going on 10 of him being diagnosed with leukemia. So we've been through the really appalling experience of being told that your child has got cancer. That's one of the worst messages you can ever possibly have, and the effect on the family is devastating. It turns your whole world upside down, and after that it's all about how you can manage to do the best by the child who's in hospital, but also keeping the rest of the family going forward. We became involved in 1988, and I'm glad to say we're very fortunate. He's alive now and in fact living in Australia with 2 children of his own. But for many, of course, that's not the outcome. Latch had been founded in 1982 by parents and the consultant oncologist at the time, who realised that the NHS couldn't provide everything needed in the hospital, and so she encouraged the idea of a parent support group, which is what Latch is. We still have children dying despite all this, and the obligation to go on fighting to help these families is huge.
I'm Dr. Mariel Jenny. I'm a consultant paediatric oncologist, and I look after children who have been diagnosed with cancer from across the whole of South Wales. My role generally is to look after patients from diagnosis and sometimes before they're diagnosed. The children then go through various investigations and tests, and once the diagnosis is made, then my job is to work with all the members of the team to lead that child's care, decide what treatment they need and take them through the treatment and hopefully into follow-up and beyond. Latch has provided enormous care for children throughout their treatment pathway and beyond. As you can imagine, it's a hugely stressful time for any family whose child is diagnosed with cancer. Fundamentally, the accommodation here allows parents to be comfortable and close to the children while they're having their treatment. The children themselves are supported on the ward both by the care workers and helpers who play with the children and look after them day to day, and importantly the families and the children are supported by the social workers, and that makes a profound difference, helping them through very difficult times, advising them, supporting them, and I know that makes a real difference.
My name's Shona and I'm the family support worker that's based on Rainbow Wood. My job is to support families while their child is on treatment. I entertain the child that's on treatment and look after siblings. I also take them out to do their shopping, help with cooking. I can also be there when they need a chat, when their child is not feeling so well or they're feeling very stressed and they need someone to talk to.
So we're the Latch social work team. I cover the West Wales area and the other girls cover the East Wales. We start supporting families when a child is diagnosed with cancer or leukemia, and we provide practical, emotional and help them to access financial support as well.
We do lots of lovely things for the families, including trips and treats and just lovely wishes for the children. In amongst a really difficult time for the families, they're having nice things.
Emotional support wise, we can help with things like sibling support. So we run a sibling group because we've noticed that siblings can really need someone to talk to. They can need to know that they're not alone in this as well. We've also helped with an advocacy role of helping to contact employers, making sure that they're aware of what's going on, advocating if we need to appeal benefits and things like that as well. Also just being a listening ear, having someone that they can vent to about their frustrations, about their emotions of what they're going through at the moment. Sometimes talking to a family member can be too difficult, and having someone that's a little bit removed from that can be helpful.
So I'm Zoe, I'm a Latch clinical psychologist. I'm funded by Latch to provide psychological support to the young person with cancer, their family, siblings, and the wider team. Often with families, they're thrown into the world of oncology very quickly. It's very traumatic and they don't have time to think about psychological things with all the scans. But actually, as treatment kind of goes into maintenance phases, that's when some of the psychological worries and distress comes. And most common, the what ifs. What if it returns? What if it relapses? What do I say? And they're the things that kind of the psychologists can help with.
When he first started having pain in her right shoulder, just after a little accident we had in the car, we took her to the doctors and they thought that it was whiplash first of all. It continued to get worse. So we took her back to the doctors who said it was a viral infection. She started coughing up blood, so we took her to the hospital, the Royal Gwent, and then they did an x-ray and said that it was a really bad chest infection. So from that point on, Millie started going downhill more. So we took her back to the doctors, who then looked at the x-ray, and they said that it was really bad pneumonia. So at the 6 weeks check-up for pneumonia, they did an x-ray and they discovered that the mass had gone bigger. They then referred us then to Noah's Ark and to see the respiratory consultant here. He did a CT scan, and by the Thursday afternoon then we found out that she had lymphoma.
The first few weeks, very tough. After that, Millie became more positive. That in turn helped everybody else, the family, our friends become more positive too. The hospital staff were fantastic, and that's when Latch sort of introduced themselves, and yeah, through their support then, things started easing slightly. There's always something in the back of your head, knowing what's happening, but through a lot of support, yeah, we started coping wise, we sort of gradually got a bit better.
Latch has been absolutely amazing. From the first time that we were introduced to Latch, where we met Steve, he just put our minds at ease, showed us where we could stay if we wanted to stay in the lovely accommodation. Places to do your washing, lovely rooms like this to sit in and relax just in case you wanted to get away from the ward. Because sometimes you just don't appreciate the fact that you've been on a ward for a week or two, and then you come upstairs and you feel carpet under your feet, which is really nice. It's just the little things. They've got a lovely little kitchen so that you can stay in. We've had an amazing support. We've got a fantastic social worker, Rachel. She just does everything for us. Anything that we need so that our journey can be, so that we can concentrate on getting Millie better, rather than, can we fill this form in? Can we do this? We've got to ring the doctors. We've got to ring certain people. Rachel just does it all for you. And support in regards to family fun days out. Any little things like this help and support us and just make your darkest days brighter.
We don't get grants or public or lottery money or anything like that. We depend entirely on what our volunteers raise, and they come up trumps year after year. The fact of the matter is that this accumulation of work that has to be done with them and things that have to be provided for them is very expensive, and it gets more and more expensive. So that our budget for this year, what we think we need to spend to provide these facilities that are so essential in their various ways, is of the order of £750,000. We are hugely grateful to the volunteers who raise that kind of money. It's a huge privilege actually to be engaged in this work, because you see the best of people in the most difficult circumstances, and it's a privilege to be associated with Latch over these years, and to be able to make a difference to these families as they testify time and again, make a real difference to them in the worst periods of their lives.